All right, I think we'll get started. I see some familiar faces from the last seminar, last session here at 1:30, so thanks for coming back. To the rest of you, thanks for joining us today. It's another Wellness Wednesday at MBFCU. And this session, I'm happy to welcome back Dave Brown from TrueLink Medicare Advisors, the team. And also with him is Michaela. I can't forget her, Michaela Slynn. So thank you both for coming today. Over the years, as we presented the Jim Schomburg sessions on retirement planning, Social Security, Medicare planning, we always had the requests from members to please follow through and provide an actual ability to purchase a product to fill my need. You help me with planning, now help me find the right Medicare plan. And so we're very fortunate that we've been able to partner with our state trade association, the Minnesota Credit Union Network, and that's an organization that represents and serves over 2 million Minnesota credit union members through their St. Paul office. Dave Brown is leading that Medicare program and is a seasoned veteran in assisting and advising others on Medicare plans that suit their needs. Dave started in the Medicare business with one of Minnesota's largest brokerages, and he served clients there for over 9 years. He then went on to work for a major Medicare insurance carrier and worked with a Medicare field marketing organization. Dave is also a former 2-term Minnesota State Senator serving District 15. And what I love most is that Dave first became a credit union member while he was a senior in high school, and now he finds himself working directly in the credit union space and helping members in Minnesota and Wisconsin for MEFCU. Michaela, as I mentioned, she's a business development specialist with TrueLink and has been working in the industry since 2015 with a focus on Medicare. I know you'll find her to be extremely knowledgeable and helpful if you have questions after the session. And just as a reminder before we start, your family members, regardless of where they live or work, are also eligible for credit union membership, and or they're also eligible to work with our Medicare team that is here too. So please share the word. If you find this of value, please invite them also to participate. So with that, please join me in welcoming Dave and Michaela.
Thank you, Mary, and thank you for being here today. Thank you to those of you who are online. If you're online, feel free to use the chat option if you have questions anytime during the presentation. For those of you who are here in the room, anytime during the presentation, if you have a question, if I said something that didn't make sense or you have questions about that, just raise your hand and I'll call on you, and we want to answer questions as we go along. So as Mary said, my colleague Michaela and I, we are employees of the Minnesota Credit Union Network. We're the trade association for credit unions in Minnesota. We're a not-for-profit. TrueLink Medicare Advisors is our division that we use to help serve credit union members who want help with Medicare. So with that, we will get started. Today's just going to be informational only. We aren't selling anything today. If at the end, if you didn't get a folder, we have folders in the back, but in your folder there's a card in there that you can fill out if you want our help. I should have brought a folder up with me, but it's a kind of a gray color, yes. That's in the folder. If you're online, you can utilize us by email or telephone. But if you fill that out at the end, if you want our help, we'll contact you individually and work with you if you need help finding a Medicare plan option. We never charge anything for our services. You'll never pay us anything. If you sign up through us, we get paid a commission by the insurance carrier. So a couple of things for Mayo employees. If you've been working with the Mayo Clinic prior to 2001, they offer a service called Via Benefits. And again, if you started prior to 2001, you're going to want to utilize Via Benefits instead of us, because you're going to get allotment of money that you can use to help pay for your plan. If you're a Mayo Clinic employee after 2001, I think it's January 16th and later 2001, you're free to use us because you do not get the VIA benefits that those who were hired earlier get. If you're a part of the Mayo Health System, you're not eligible for the VIA benefits, and we would be more than happy to work with you in that respect too. Any questions on that?
Yes.
Yes.
Can we only get our health savings account if we go through VIA then?
If you qualify for VIA benefits, you will only get your health savings, that money, through them, yes.
Thank you.
If you don't go through them, you lose out on that. It's a fair amount of money. You really don't want to lose out on that. If you're not eligible, we want to work with you. We'd love to work with you. Working with us? Well, your Human Resources Department would have sent you information at whatever time you retired on VIA benefits. So if you're not aware of whether you are, you'd want to contact your HR department and find out. So disclosure, we represent all the insurance carriers for Medicare Advantage plans and a lot of the Medigap plans in Minnesota. There are actually 8 in this area. We represent all of those. That's over 61 plan options that would be available to you just for Medicare Advantage plans. If you wanted to go with a Medigap plan, then there's several more options available to you on that. And we're going to go over the differences between the two in just a moment. So our agenda for today is we're going to talk about why you would want to use TrueLink, Medicare advisors, what is Medicare and what does it cover, what doesn't it cover, what are the enrollment periods and deadlines you need to follow, what are your costs associated with Medicare, what if you choose to work past the age of 65, which a lot of people are doing, we'll talk about that, and then your private insurance options. So any of you who are 64 or older, you're probably receiving a ton of postcards and things in the mail every day about why you should go with a certain carrier or certain agency for your Medicare needs. That's just going to continue. I'm sorry about that. When you go through VIA benefits, you know, you can ignore that. When you go through TrueLink Medicare advisors, you can ignore that too. We have been scrutinized by a Mayo Employees Credit Union and vetted by them, and they've expressed their confidence in our ability to serve you well. You'll also, especially in the fall, see a lot of Medicare ads on TV. You're going to see Joe Namath and William Shatner and J.J. Walker and a whole bunch of people telling you that they can promise you the moon if you call their 800 number. Don't call their 800 number. Most of those, what they're promising, they're not even available in Minnesota. They're available in some states, which is why they can do it nationally, but a lot of what they're telling you you can get for free is not even available in Minnesota. And what they do, if you choose to call in, they're going to sell your name and information to another agency, and they're going to be hounding you incessantly to try to schedule an appointment with you. So that's how that works. So like I said, our services, there's no cost to you. We will help you create a Medicare timeline. Let's say you continue to work past the age of 65. If you want to meet with us now, we're happy to discuss when's the appropriate time for you to start looking at Medicare, around your retirement, and all those types of issues. We'll provide you with education and consultation. Again, like I said, we offer multiple companies available for Medicare. There's not one plan that's perfect for everybody. If you meet with us, we're going to ask you for a list of your medications that you're taking. We'll ask you for what providers you want to see. So we're going to make sure your providers are in network, that your prescription medications are going to be covered. So we can't just say, oh, this is the top selling plan in Minnesota, just go with that. It doesn't work that way. Not if we're doing our job, it doesn't. And then we're available throughout the year whenever you have questions or need assistance with anything. And again, that doesn't cost you anything. So some of the guidance and education we offer to you is when you should enroll in Medicare Part A and B. For some people, this is going to be based around their 65th birth date. If you're continuing to work or your spouse continues to work and you're on the Mayo health plan, you can delay your Medicare Part A and B. We'll go into that in a little bit. We'll talk about the documentation you would need. If you delay your Medicare past the age of 65, you're going to need Mayo HR to fill out a form so that you don't get penalized once you do enroll. We'll go over what Medicare covers, HSA contributions, and all that sort of thing. So original Medicare. Does anybody know what parts there are besides A and B? C and D, good. So Part A is hospitalization, and Part B is your outpatient services. This you're going to get through the government through Social Security. If you're collecting Social Security benefits at the age of 65, you will automatically receive your Medicare card in the mail about 3 months prior to your 65th birth date. There may be reasons you don't want that. Let's say your spouse is still an employee of Mayo, or you are, and you're on your employer insurance. You don't want to be paying the Part B premium to Social Security when you don't have to be paying that. That's roughly $175. You can delay that. So if you receive your Medicare card automatically in the mail around your 65th birth date, but you have an employer plan, they give you instructions on how you can delay signing up for Part A and B. For Part A, there's not a monthly premium. The Medicare tax that's been coming out of your paychecks for years, that's what's funding Medicare Part A. Part B, there is a monthly premium. This year, it's $174.70 a month. That fluctuates from year to year. There's been a couple years where it's gone down. It goes up typically. It doesn't often go down, but it may. And then there's deductibles and copays. I'm not going to go into all the copays and deductibles for Part A and B, because when you sign up for either a Medicare Advantage plan or a Medicare Medigap supplement plan, those really don't pertain to it. So I found over the years when I tend to highlight these things, it just gets confusing for people. So I won't go into a lot of that unless you have specific questions on that. What is Original Medicare? It's medical insurance, government funded for a lot of it. It does not provide 100% coverage. So if you just had Original Medicare and didn't want any type of supplemental coverage, it's not going to provide coverage for dental. It won't give you worldwide coverage. It's not going to cover routine hearing exams or hearing aids, fitness benefits, routine eye exams, your prescription drugs that you pick up at the pharmacy. Original Medicare doesn't cover any of that. You need to pick up supplemental plans to cover those extra things if you want those things. Does that make sense? Okay. So enrollment periods. The first enrollment period is going to be your initial coverage enrollment period. This is based around your 65th birthday. So your ICEP will begin 3 months prior to the month you turn 65. It will continue the month of, and then 3 months following the month you turn 65. That's for those of you who want to sign up for Medicare based around your 65th birth date, and you don't have employer coverage either for yourself or if you're going to get through a spouse. That would be your enrollment period. If you're someone who's going to continue working past the age of 65, there's what's called a special election period. And that's for those folks who continue working past the age of 65. They want to keep their employer coverage. They have what's called a special election period. It begins 2 months before you're going to retire and leave your employer. So that's kind of a time frame for you. If you know, say you're 68 and you're thinking, I'm going to retire at the end of the year, you're going to want to start working towards applying for Medicare Part A and B to be effective whatever month you're going to be without your employer coverage, and some of the other things that you would need. And that's where we can come in to help you. If you need our services, we'd be happy to schedule a time to go over all of that with you. It says that it continues for 8 months after your active employment, which it does, but you don't want to go 8 months without health insurance coverage. You want to sync it up so you seamlessly go from your employer coverage right on to Medicare, so you're not without any health insurance coverage. And then once you are signed up for Medicare, every year there's the annual election period. And that's every year, October 15th through December 7th. And for those of you who are on a Medicare Advantage plan or a standalone prescription drug plan, every year there could be changes to your plans. You can have us review that for you every year. And if there's changes to your plan, you have that opportunity to switch to another plan option, and it would go into effect January 1 of the following year. Does that make sense to everybody? Okay. And then there's also, this was created probably about 5 years ago now, the Medicare Advantage open enrollment period. So if you have a Medicare Advantage plan and you think, you know what, I was happy with it this year, I don't think I need to have my coverage reviewed. I didn't bother to read the material my insurance carrier sent me about the changes that were taking place. And then January comes along and you go to the pharmacy and you find out a prescription, probably an expensive prescription that your insurance carrier covered last year, they're no longer going to cover it this year. This enrollment period gives you one more opportunity to find a Medicare Advantage plan that will cover the needs that you have for prescriptions and providers and all of that. And that's going to run from January 1 through March 31st. Yes?
So the Medicare Advantage plans end up covering prescription drugs better then?
So, and we'll get into this, but Medicare Advantage plans are going to include your medical, prescription drug, dental, vision, and hearing. They'll have fitness benefit memberships. There's a lot of things they have all in one monthly premium. A Medigap supplement plan is only your medical, and then you would need to add on a prescription drug plan. And if you wanted dental, vision, and hearing benefits, you need to add on policies for those things too.
So then the Medicare Advantage, that is your drug plan?
It is, yes.
Okay.
Mm-hmm. So working past the age of 65, there are times when I think the Mayo has a pretty good health plan for their employees, but if your employer's health plan is not very good, there are times when going on to Medicare is a better option for you than to keep your employer plan. I'm not sure that's the case with the Mayo employees, but there are times when that would be true. And if you wanted us to help compare that for you, if you have that usually comes out in November when the Mayo tells you what the plan's going to have for the next year. If you want our help in comparing your options between Medicare and staying on your employer plan, we'd certainly be happy to schedule a time to do that with you prior to whatever your deadline is for making a choice for next year. Applying for Medicare Part A only, oftentimes HR people will tell you, go ahead and apply for Medicare Part A because you don't pay anything for it. If your employer plan has an HSA, a health savings account, and you sign up for Medicare Part A once you're 65, you can no longer contribute to your HSA account. So if you have an HSA account, you don't want to sign up for Medicare Part A and B. You can delay it without penalty, and you want to do that if you want to continue contributing to your HSA account. And I do have a handout in your folders that kind of goes into more depth on that. So when you're ready to retire, you'll want to stop contributing to your HSA several months before you're ready to retire. You can apply for Medicare Part A and B online. So if you delay your Medicare Part A and B after the age of 65, you can go online to Social Security. It's ssa.gov. If you've created an account for you on Social Security already, and it's called a My Social Security account, if you've created that, if you haven't, you probably should, because it's going to tell you what your benefits would be once you're getting ready to retire. You know, if you retire at age 65, 66, 67, it's going to tell you what your monthly benefits would be. So applying for that online would be helpful for you in making a decision. But if you have one of those accounts, it's fairly simple to sign up for Medicare Part A and B once you're ready to do that. And again, if you need help with that, we'd be happy to help you with that. And then people say, well, my neighbor told me if I don't sign up for Medicare when I turn 65, I'm going to have a penalty to pay the rest of my life. That's not true if you or your spouse are still working and you have an employer plan. Once you get ready to retire, there's a form called the Employer Verification Form that the Mayo HR will fill out for you, and it's just verifying that you had an employer plan and therefore you won't have penalties to pay on your Medicare Part A and B. Any question? This is what the form looks like. Yes?
So that employer verification form, where do you get that from?
Through the HR department, and the Mayo's big enough, I'm sure that they do this on a regular basis. If not, we can send you that form.
I believe so.
Yeah. Yeah, okay. But it's just a one-page form that looks like this. Yeah, it's just so that Social Security knows they don't charge you a penalty for not signing up for Medicare when you turn 65. Yes?
Okay, so, I'm sorry, I got lost. This is, I'm gonna work till I'm 70, but at 65, I have to request this from you?
No, this you'll only need once you get ready to sign up for Medicare Part B, and that's going to be based around your retirement. Then they need to fill out this form for you, and if you apply for Medicare Part B online, there's a place where you just upload this form, and that's what keeps them from charging a penalty.
Okay, so it's after the fact.
It is,
Okay, got it.
yes.
Thank you.
Yep, good question. Were there any online? Yes.
So Scott T asks, if I am covered under my spouse and I am age 65, I declined Part B but kept Part A since it is free. Is that the correct way?
Well, it's the correct way if you're not contributing, Scott, to the HSA, if you even have an HSA. So that's perfectly fine to sign up for Part A if you're on your wife's employer plan. She's probably the one who's contributing to the HSA. So yes, that's the right way to do it.
Jolie G asks, please explain the difference between Medicare ADV plans and Medigap. Does everyone need both? If not, how/why choose one over the other?
Okay, and that's going to be next in our presentation. But just to kind of give the broad overview there, everybody needs Medicare Part A and B to sign up for either a Medigap or a Medicare Advantage plan or a standalone prescription drug plan. You need Medicare Part A and B to get the supplemental type coverage. In just a few minutes, we'll go over the differences and it will answer your question. Yes?
Can you repeat the hire dates that make someone eligible for VIA benefits or not?
Yes, so if it's the Mayo Clinic, if you were hired prior to January 15, 2001, once you retire, you'll be eligible for the VIA benefits. If it was after that date, they're not offering you the VIA benefits where you get the HR. Yes?
Well, last month I took the, it was for the pension. So they sent things, and I got a couple printouts, but this here says it's before January of 2002. That says that that's subsidy. You could qualify for the subsidy, is that what
Yes.
you're talking about?
Mm-hmm.
But then if you are hired after January of 2002, then it's just strictly to that VIA benefit, correct?
If you're after 2002, and they're saying 2002, I was told it's 2001, but if you have the printed material, we'll go with 2002.
I'm just curious.
My understanding is they aren't using VIA benefits for you if you were hired after 2002, we'll say.
Okay.
Yeah. And that's good to know. I was told it was 2001, but 2002, it's good to know. Yes?
Also, I was hired way before that, and I don't get any subsidy.
Oh, you don't? Are you with the clinic? Okay. That's good to know. I'm learning a few things from you. Keep telling me these things.
Well, I gotta
Yeah.
take that back. I don't get a subsidy because I'm eligible for Mayo Clinic's supplement.
Oh,
And I think after my retirement, I think then they got subsidies,
okay. Okay,
and then you don't get the Mayo Clinic supplement plan.
okay. That's good to know too. This chart that you see on the screen now is if you're higher income, you're going to be charged a surcharge on your Medicare Part B premium and on your Medicare Part D premium. So these numbers increase every year, and they base it on your tax returns from 2 years ago. So in 2022, if you filed your taxes singly and you made $103,000 a year or more, and that's your modified adjusted gross, they're going to add on a surcharge to your Part B premium and your Part D premium. If you're married and filed jointly, filed separately, but if you're married and your joint income was $206,000 a year or more, Social Security will add on a surcharge to your Part B and Part D premium. That surcharge lasts through the rest of the year, and then they reevaluate your income every year based on your tax returns from the previous 2 years, or from 2 years ago. And there may come a point, if your income drops, that surcharge will stop. But this is if any of you are the higher income earners. Any questions on this? Yeah, Don.
Could you talk about the form to get a waiver on that surcharge?
You can apply for a waiver through Social Security, and they're going to evaluate your reasoning for doing that. They may agree to waiving that, and they may not agree to it. But if you don't agree with the surcharge that they're going to apply to you, if you're in that category, you do have the option of appealing it. And again, it's at their discretion as to whether they're going to approve that appeal or not. Yes?
These surcharges are based on income.
They are. From the
You have your original, what it's gonna cost, and then if you have more income, I take it we're gonna charge you more.
That's right. So you can see if your income on this category, if your income falls into that 206 to 258, your premium basically doubles, and then it keeps going up based on your level of income, and then they add on these amounts for your Part D prescription drugs, and that'll last through the rest of the year. And then they reevaluate it each year after that. Because some people, maybe you took a payout of some sort, or 401k, or something that really elevated your income for 1 year, and if you happen to take it in that 2 years prior to when you're going to sign up for Medicare, you're going to have these surcharges to pay, and then your income dropped back down the following year. It only lasts for the rest of that year, if that makes sense. So it's not a lifetime thing. It's based on your income from year to year. So private health insurance options. So this is getting back to a question we had online. So you have the option of a Medigap or a supplement plan. These are the plans that have been around since Medicare started. We have Medicare Advantage plans. They started in the year 2006. When they first came out, they weren't that great. Their coverage wasn't that great. And some people still hold that a negative viewpoint of Medicare Advantage plans. Medicare Advantage plans have gotten very competitive and very strong over the years. So they're much better than what they used to be when they started out. And then if you have a Medigap plan or a supplement plan, there's also what's called standalone prescription drug Part D plans that you can add on to your Medigap plan for prescription drug coverage. Those came about in the year 2006 also. With the Medigap plans, in Minnesota, of course, we have to do things a little differently in Minnesota, but in most of the nation, the plans are going to be like Plan A, B, C, G, F, all of that. We call them differently in Minnesota. They're standardized coverage. We call them basic, extended basic, co-pay plans, similar to what a Plan N would be in other states, high deductible. But anyway, we can walk you through that. Supplement plans in Minnesota are a little bit more expensive, well, quite a bit more expensive than what some other states offer. We have what's called community rated, meaning it doesn't matter what your age is, you're going to pay the same amount if you go into a supplement plan at the age of 65 or whether you're 85, and the rates tend to go up every year. Minnesota legislature in 2022, I think it was, maybe it was last year, they created a new law for Minnesota where starting next fall in 2025, they created an annual enrollment period for Medigap plans, like there is how I told you about October 15th through December 7th. You can switch Medicare Advantage plans. The Minnesota legislature created an open enrollment period those same dates for Medigap plans starting next fall. So let's say you went with the Medicare Advantage plan when you first options, and then down the road you decide, I wish I could get into a Medigap plan. Well, in Minnesota, you're going to have that open enrollment period next fall to be able to do that without a health questionnaire. If you want one, you're basically going to be able to get one during October 15th through December 7th. That's not been the case up until next fall here in Minnesota. Other states have that, Minnesota has not. So the point of that has been, if you didn't sign up for a Medigap plan in Minnesota when you were first eligible, and let's say down the road when you're 75 or whatever and you wanted to switch to one, you would have been asked health questions. And if you answered yes to any of the health questions, they're going to deny you coverage. You wouldn't be able to get a Medigap plan. Again, that's changing next fall in Minnesota. The benefit to a Medigap plan is anybody who accepts Medicare will allow you to see them as a patient if they're taking new patients. There's not a network. If they accept Medicare, they'll take your Medigap plan. It travels with you. In Minnesota, that's a downside to having a Medigap plan, because let's say you move from Minnesota to Florida or Minnesota to Texas, if you had a Medicare Advantage plan, you'd have to find a plan available in that state. Well, if you have a Medigap plan, you're not going to lose your coverage. The bad side about that is they're a lot cheaper in Texas and Florida to get a Medigap plan than what they are in Minnesota. So it just depends on where you would be going. That maybe that's a good thing that you don't lose it. Maybe it's not such a good thing. You can live wherever you want to across the country and keep your Medigap plan. If you don't join within the first 12 months of having Medicare Part B and you want to sign up for a Medicare Medigap plan, you'll be asked health questions, as I said, and if you answer yes to the questions, they'll deny you. You'd need to go with a Medicare Advantage plan. Any questions on that? The average price of, so like the top plan, extended basic plan in Minnesota, where basically you have a copay of $240, and then after that you don't have any copays for your medical things that Medicare covers. A plan like that's going to run anywhere from $275 to $300 a month or more in Minnesota. Then you would need to add on a prescription drug plan, and if you wanted dental, vision, and hearing coverage, you would need to add on plans to that. So they can get a little pricey, but for some people, they like the soundness of mind of not having the copays and being able to go to any provider they want. Now, compare that to Medicare Advantage plans. Medicare Advantage plans give you one monthly premium for your medical coverage, prescription drug, dental, vision, and hearing. They combine all of that together for one monthly price. And those monthly premiums run anywhere from $0 to up around $100 or more. So they're much more economical, and they offer a lot more benefits. But they do have networks. So when you meet with us or whoever you work with, we would go through, ask you what doctors do you see, are you seeing specialists, what clinic do you want to go to, who's your dentist. We want to make sure that all of those providers are in network on whatever Medicare Advantage plan that you would choose. And we'd also take a look at your prescription medications to make sure that whatever plan you chose are going to cover all of your prescription drugs. They also give you dental in that price. They give you, like I said, vision, hearing. They give you gym memberships at, LA Fitness, Lifetime, whatever the club is that's in the network. And they give you a maximum amount of pocket protection. What that means is if your copay is at up to a certain dollar amount before the end of the year, if you hit your maximum amount of pocket protection, then you don't have any copays for the rest of the year. There is a provider network. Some of the plans in Minnesota, 96 to 97% of providers are in network, so it's not a huge issue. So, a lot of people are scared thinking, oh, my doctor won't be in network with a Medicare Advantage plan. That's not the case in Minnesota. It is the case in some other states. They don't have as high a rate as participation as we do in Minnesota. But for several plans, it's upper 90% of providers who accept Medicare who are in the networks of these plans. So that's not as big a fear in Minnesota as it could be in other states. They give you national coverage? Yes.
Who are some of the ones that won't take this, the big ones?
Well, some have, like Blue Cross, UCare, Medica, they all have 95 to 97% of providers in network. United Healthcare is over 90%. Humana's percentage is not good. A little stronger down here in Olmsted County, but Humana's network is probably the smallest of any of them in Minnesota, so you'd kind of want to avoid that. Yeah. And your Medicare Advantage plan does not move if you move. So Medicare Advantage plans are based on the county that you live in within the state that you live. So let's say if you live in Olmsted County and you moved up to Crow Wing County, you'd have to work with us to find a plan that's available for you in that county. Or if you move from Minnesota to another state, we could work with you to find a plan that's available in the other state. The nice thing about it is, if you move and you lose your plan because you moved, you're eligible to get a Medigap plan in another state at a much cheaper rate than what Minnesota offers, and you won't be asked health questions because you lost it against your will. Because you moved, you lost that plan against your will, you're eligible to get a Medigap plan in another state where they're considerably less money than they are in Minnesota. Yes?
If you were to move and you go to that Medigap, can you go back to an Advantage plan?
You can. You have the option of going with a Medigap or in a Medicare Advantage plan when you, yes. Good question. You aren't asked any health questions when you sign up for a Medicare Advantage plan, and your benefits and your premium can change every year. They don't tend to be real drastic, but they can, yes.
How come Minnesota's so high?
I don't know. And you know, the highest area is here, well, the highest area is down here in southern Minnesota, and people say it's because if you want to be in the Mayo's network, you're going to pay to be in the Mayo's network. So the highest premiums you're going to see on Advantage plans are down here in Olmsted County. So a plan in the metro you could get for $64 a month. Down here it's $108 a month. So it's just some of the differences. Yes?
I have a question. So you're talking about like Advantage plan and Medigap. So if you took a trip to another state, you don't have medical coverage then?
You would. With either plan, you would have medical coverage. So the Medicare Advantage plans, if you're just traveling across the country, they all have national networks now. They didn't used to back when they first came out. They all have national networks. All you do is you call the member services number on the back of your insurance card. They're going to ask you what zip code you're in, and they'll give you a whole list of providers you could go see. If it's an emergency at the hospital, you're going to be covered. But let's say you're spending the winter down south and you just wanted to have a doctor down there, they'll tell you a whole list of doctors you'd be able to go see.
So changing out like from Medigap to Advantage, that's only if you're gonna actually physically move
Yes.
from Minnesota, say, to Florida.
Yeah, that's only if you physically move, and you have to notify Social Security that you've moved, or they have ways of finding out, but yeah, you have 60 days. You have 60 days from the time Social Security is notified that you've changed your address to another state to find a plan available in that county in that state. Yes.
Elizabeth P. asks, how does Medicare calculate your premium? Is it MAGI determination, et cetera, other things?
So there's a set premium this year for your Part A. There's no premium if you or your spouse worked for at least 10 years in the United States and paid into the Medicare tax. Your Part B premium is going to be $174.70, and that can fluctuate from year to year. But for the modified adjusted gross income, they're going to take a look at your tax returns from 2 years ago, and if your income was at those levels, they're going to add on that surcharge for the rest of the year.
Dave,
Yes.
just to kind of chime in, I think maybe they're wondering, like, why are plans, the same plan benefits, why is it less expensive in the metro than it is in Olmsted County?
Oh.
And I think a lot of that comes down to like actuarials and all that
Yep.
farm insurance stuff, right?
Right, it does. Yeah, so I mean, I can't explain to you why plans are more expensive. They're least expensive in the metro where you think they would be the highest. I'm talking about monthly premiums. But the metro has the lowest for Advantage plans, then northern Minnesota, and then southern Minnesota has the highest premiums on Medicare Advantage plans. For Medigap plans, they're the same across the state.
So there's nothing based off of age, and I think that's kind of.
No, there's nothing based off of age. No, not in Minnesota. Other states, they are age rated. In Minnesota, they're not.
Do most commercial payers require you to sign up for Medicare primary even if you are working?
No, that's your choice. It's the insurance carriers have nothing to do with that. If you're continuing to work or your spouse is working and you're on that employer's insurance plan, you can delay, again, you can delay your Medicare Part A and B until you get ready to retire, and that's you and your spouse. So you may have a spouse who, maybe your spouse started collecting because they retired, but your spouse continued working for the Mayo. Your spouse signed up for Social Security benefits at the age of 64. So 3 months prior to their birthday, when they turn 65, they will automatically receive a Medicare card in the mail. There's instructions on how they can delay their Medicare, at least their Part B coverage, because if that's you, where you have a spouse who was automatically put on Medicare Part B, but they're on your employer plan with you, there's no reason for you to be paying that $175 a month for Medicare Part B if they're on the employer plan, because it really doesn't, there's little value to you for doing that. So you can delay your Medicare Part B and not have to pay that premium if you still have an employer plan because someone, you or your spouse, is still working. Yes?
Did you say automatically, like without us, our permission, put us on Part B?
If you're collecting Social Security benefits at the time you turn 65, they will automatically sign you up for A and B. Yeah.
They get to choose?
They choose, and then they also send instructions on how you can delay or suspend your Medicare Part A and B. Okay, any other, was there another question online? Did I answer the last one? Okay.
Another question they asked, does Mayo allow non-Mayo spouse to remain on our insurance if they are eligible for Medicare? Is there an extra charge like when a spouse turns down their employer's ins and opts for Mayo instead?
Does any, I don't know for certain. I think if the spouse is on the Mayo plan once they turn 65, they can delay their Medicare. There's not an extra charge. If the spouse hasn't been on the Mayo plan and they opt to go in around the age of 65, I don't know the details to that. I don't know if anybody in the room does. Yes?
I know when my husband was working full-time and he had access to insurance, he was stayed on he was on my insurance instead of his. Then he had a little bit of a,
Okay.
I forget what it's called.
Like a surcharge or something?
It's like a surcharge.
Yeah.
You have the regular cost, plus then first year it was like $50 a month surcharge, then it went to $70.
Okay.
But then since he's semi-retired, then now he's just on my insurance, and that charge went away then,
Okay.
because he's not working.
So for the person who asked online, this lady in the room said there was a surcharge when her husband first went on, but that went away after some time. I would advise anyone with those types of questions to call your HR benefits line with Mayo to find out the specifics of that. Okay, and then Medicare Part D plans. These are called standalone prescription drug coverage. You would pair this up if you wanted prescription drug coverage with your Medigap or your Medicare supplement plan. These types of plans can run anywhere from $5 a month to over $100 a month, depending on the plan that you go with. Each insurance carrier has different formularies. A formulary is a list of your prescriptions that they cover. So we can look that up for you and find out which ones are going to work best for you based on the prescriptions that you're taking. There's different tiers of coverage. Tiers 1 and 2 are typically generic medications. Oftentimes on Tier 1, you don't have copays for your generic meds anymore. Tier 2, you may or may not. Tier 3 are going to be brand name or more expensive generic medications. Also Tier 4. Tier 5 would be any specialty medications. And then some plans have a Tier 6 for the really low cost generic medications. Some of this is going to change next year. Congress changed the rule on Part D plans, and I'm going to go over that on the next slide. If you don't enroll in a Part D plan when you're first eligible, and that's based on either when you turn 65 or when you leave an employer plan, you're going to have a surcharge or a penalty that you would pay once you did sign up for a Part D plan, and that's going to be a penalty every month for the rest of your life. So if you work with us, we encourage you to go with a plan that offers Part D prescription drug coverage. I've worked with many people over the last 16 years who say, I don't take any medications and I'm never going to, and they don't want Part D coverage. That's your choice. If things change down the road and you decide you need to go on a Part D plan, when you didn't when you were first eligible, you're going to have a penalty applied to your monthly premium, and you're going to pay that every month for the rest of your life. Yes?
Can you change your tiers later down the road?
The tiers are the insurance carriers determine the tiers and based on what medications you're taking and so forth. So let's say you're taking generic cholesterol medication. Most of those are going to be Tier 1. If you're taking maybe generic heart medication or something, that could be tier 1 or tier 2. If you're taking a brand name like Eliquis or Januvia or something like that, typically that's going to be a tier 3 or tier 4 where you have a copay for the medication. But every insurance carrier is going to be a little bit different. That's why we'll ask you for a list of your medications, because you want to know up front before you sign up for a plan what your medications are going to cost you each month. And when you meet with us, we're going to tell you this is what your costs. When you go to the pharmacy, these are what your costs are going to be for your medications. You don't want to be surprised when you go to the pharmacy and find out the plan you signed up for isn't going to cover an expensive medication and you're paying $300 a month for your medication. If you do that, somebody didn't do their job for you. Yes? Oh.
So he has to get infusions
Mhm.
every 2 weeks, and they're extremely expensive.
Yep.
Is that covered under this?
So infusions, any medications that are administered at a clinic or a facility, that's called Part B, as in boy, medications. That's covered under your medical plan. And for Medicare Advantage plans, you're going to pay 20% of those costs up until you've reached your maximum out of pocket. For a Medigap plan, at least if you go with the extended basic, you won't be paying those costs. You'll be paying more per month, but you won't be paying for the cost of the infusions.
Okay.
Yes?
So if you are ready to retire and you are ready to sign up for this and you're not taking any medications, how would you get a Part D so that you don't have
Yeah.
any charges later on? Because
Yeah.
most of us will need hypertension
Right.
meds,
Yeah.
something, right?
Yes.
What do you do?
So for those of you listening online, her question is, what if you're not taking any medications when you first sign up for Medicare? What would you want to do? If you sign up for a Medicare Advantage plan, that's going to include your prescription drug coverage and with a monthly premium, so that's a good option. If you go with a Medigap plan, you could get a standalone plan. This year there's one for $5. You could certainly go that route. If you go without and down the road you do need it, then you're going to pay a penalty. Yes? Oh.
No, just service connected, like the VA,
Mhm.
service connected disability. They state that they're offering healthcare services, but they're not calling it health insurance, which is healthcare services beyond your service connected disability. And then there's a cost sharing, zero premium on that.
Mhm.
Do you know much about that?
I know some. So if you're a veteran and you use the VA, you have prescription drug coverage through the VA. So you wouldn't be penalized down the road if you wanted to sign up for a Medicare Part D plan in the annual enrollment period. There are Medicare Advantage plans out there for veterans who use the VA. They're zero premium. You don't pay anything for them. But a lot of them pay you back a portion of your Part B premium that Social Security takes out. They give you a lot of extra benefits, and you don't pay anything for them. So that's an option for veterans too. But if you're getting your prescriptions through the VA, you don't have to have a Part D plan. And down the road, if you do want one, you won't pay a penalty because you had prescription drug coverage through the VA.
This is just a comment by my veteran service officer, but it was his opinion that it was better to go with just Medicare A and B. Do you have a thought on that?
Yeah, so if you're using the VA, you can go with Medicare Part A and B, but in my mind, if you can get a zero premium plan, these plans don't include prescription drug coverage, but for $0 a month, you get a free gym membership. Some of them pay you back $100 on your Part B premium per month. So instead of Social Security taking out $175 a month, they're only taking out $75 a month, and you don't pay anything for them. So they give you over-the-counter benefits where you get a catalog of 600 items and you get up to, I don't know, $50 every quarter. You can order for free. There's a lot of benefits for veterans on those types of plans. So if I were a veteran, I would be doing that, but that's a personal decision. Yeah. Yes? Okay. Were there questions online?
Scott T asks, if I move to another state and enrolled in Medigap, will my Medigap plan remain without any underwriting from the state I moved to?
Yes. So if you have a Medigap plan and you move from one state to another, there's really no change in your premium. There's no change in your plan. You can keep that Medigap plan. You're going to pay the rates of whatever they were of the state where you first signed up for that plan. But yes, you can keep that plan. You're really not going to see any changes. Yes?
What's the penalty on that Part D drug thing if you don't?
The Part D penalty is 1% of the national average. So let's say what that's come out to basically is about $4 a month for every year. So let's say you went 5 years without prescription drug coverage and then you signed up. So if you take $4 times the 5 years, that's $20 a month penalty you're paying for the rest of your life. Yeah. And that national average changes from year to year. So some of the things that are changing for next year. This year, we have stages, and we will next year too, to your prescription drug coverage. Many of you have heard of the phrase donut hole or coverage gap. That's kind of going to go away next year because of laws that Congress has changed. But the first stage to your Part D coverage is your deductible. Some plans have a deductible you have to pay before your co-pays kick in for your meds. Some plans don't. Next year, that deductible, the highest insurance company can charge is going to be $590. This year, it's $545. But you would have to pay the first $545 before your co-pays kicked in. If you have a prescription drug plan with a deductible, some of them only have deductibles for Tier 3 and higher. We go over all that with you. I don't want to get too much into the weeds on that. Once you've met that deductible, if you have one, then it's Stage 2 is the initial coverage, where you pay co-pays for your prescriptions. That either continues through the end of the year or until, and that's for this year, you hit Stage 3, which is the coverage gap or the donut hole. That would happen this year once the total cost of your medications reached $5,030, and that's the co-pays you've paid, the deductibles you paid, and what the insurance company has paid. So you add all those together, if the cost of your meds this year reaches $5,030, you're going to hit the donut hole where you'd pay 25% of the cost of your medications. That would either continue until the end of the year or until you hit Stage 4, which is catastrophic coverage. Catastrophic coverage happens once the total cost of your prescriptions, that's what you and the insurance company have paid, reaches $8,000. And if you hit that this year, then you're not going to pay anything for your medications through the end of the year. This is changing for next year. Congress has capped prescription drug costs next year at $2,000. So next year, if you've paid out $2,000 for your medications, the insurance carrier is going to be required to pay 100% of your prescription costs for the rest of the year. So that's a good thing for consumer. It's probably going to raise monthly premiums, but in the long haul, if you're one of those persons, it's a good thing. Also, if you're on insulin, a few years ago, Medicare capped the cost of most insulins at $35 a month copay. In the past, they were hundreds of dollars for folks on insulin. Those costs have been capped for a few years now if you're on Medicare. So the costs of Medicare, Part A, again, you don't pay anything for your Part A premium if you or your spouse paid into the Medicare tax for at least 10 years in the U.S. The Part B premium's $174.70 this year, whether you're on Medigap or Medicare Advantage. Medicare Part C plans, they start at $0 a month and go up to $100 or more per month, deciding on which plan that you want. If you're on a Medigap plan, those are going to range anywhere from $75 to $300 a month more. And then adding on a prescription drug plan to your Medigap could be anywhere from $5 to $100 or more, depending on the type of plan that you go with. So there's significant differences in monthly premiums between the two plans, but there's also some differences in coverage. Yes?
Have they come up with a new premium amount for next year yet?
No. People laugh every time I say that, but being it's an election year, it'll probably be after the election. If it's going up. If it's going down, they'll announce it before. That's just the history of it. If the last election it went down and they announced it prior to the election, typically if it's going up, they wait until after the election to announce it. So typically November they'll announce. Yeah. Yes? Oh. I don't think we can distribute this. There's reasons why it, for us to be able to distribute it, we have to have it approved by Medicare, Centers for Medicare and Medicaid Services, and it's not. So legally, we're not allowed to. The booklet that we have in the folder has some basics, but if you have, yeah, so this has some basic information. If you had specific questions about anything, you can certainly email us or contact us with the information, but we would be happy to, but we're not allowed to. Again, we're here to answer any questions that you have. The gray slip in your folder, if you fill that out, if you want our help, write on there about what time of the year that you are going to retire or when your birthday is, or talk to us afterwards. We'd be happy to meet with you one-on-one. And we'll meet with you in person if you're here in the area. If you're online and watching in another state, I have appointments scheduled next week, Zoom appointments I can schedule with you, or over the phone to go over some of these if you want help that way. We're more than happy to do that. We would love to offer you a consultation if you have to use VIA benefits and you don't, maybe you've had some consultations with them and you're not sure that they've given you the best advice based on being in Minnesota or Florida or Arizona. We can certainly talk to you about that too. We wouldn't be able to actually sign you up for the plan, but we're happy to offer you our advice on that too if you wanted it. So with that, this is our contact information. I have my card in the folder, and there's some free items here you're welcome to take afterwards. It has our contact information. For those of you watching online, I have our email address, a phone number. Feel free to contact us and we'd be happy to help you. Yes, sir.
How do you get reimbursed for an item in C and D?
How do we get paid? Or,
Yeah.
so we get paid. If you sign up for a Medicare, Medigap, or a Medicare Advantage plan with us, we get paid a commission by the insurance carrier.
And
If
those commissions, kind of talk about how that's regulated, I guess is probably a good way to talk about it.
So we, several years ago now, it used to be that insurance carriers paid, some of them paid a lot of money, some of them didn't pay much. So there were agents out there winning trips if they directed all their business to one carrier. Medicare standardized that several years ago. We get paid the same commission whether you go with company A, company B, or company C. We get paid the same. So the point of that was, and it was a good decision that Medicare made, we're not going to try to steer you one way because we win a free trip. We get paid the same. We don't win free trips anymore. So we're going to hopefully focus our energies on choosing what's best for you, not what's best for us. We get paid the same no matter what insurance carrier you go with.
I'm talking about items or out-of-pockets that you incur when you get drugs.
Oh, and
How do you get paid back?
how do you get paid back? Like you as the customer? Well, you have to pay you don't get paid back. Let's say you have a Tier 3 medication that you have a $47 a month copay on. You don't get paid back that $47 a month copay. Starting next year, once you've paid out, if you're in that category, if you've paid out $2,000 towards your medications, you no longer have to pay for your medications. But you don't get paid back for the copays that you pay. Is that what you were asking? Okay. Yes. We actually cover the whole state, but when we meet, if you want to meet with us, we can meet you at one of the Mayo Credit Union branches. We can come to your home, whatever, come to a local coffee shop, whatever works best for you. But yeah, we would meet you either here or at another branch or whatever worked for you. Yeah. Mayo Credit Union branches? I know there's one downtown. Do you know? Yeah.
Yeah, someone just asked where the branches were in Rochester. There's one on 41st Street, and there's one over by the Mercedes-Benz dealership south of town, and one right here next door.
Yeah. And if you're in another state, if it's not drivable, we'd be happy to set up a Zoom call or a phone call or whatever works best for you.
And then again, you are paid by, if we went through your
Mhm.
service, you are paid through the commission, through the insurance, or say if you
Yeah.
signed up for Blue Cross
Yeah, then Blue Cross Blue Shield would pay us a commission.
They pay.
Yes. Yeah. Any other yes?
It's only rumors, but you hear some drawbacks to Medicare Advantage plans in general. You go in for a procedure, I don't know if it means you have to have prior approval, or they'll only authorize some things and they won't authorize other things at all. Is there
Yep.
stories like that?
So, yes, there are some stories like that. And the question was, there's rumors that Medicare Advantage plans, they deny claims more often than Medigap. Some carriers do. That's why in Minnesota, Humana has gotten not a good reputation because they're probably the worst carrier for that. The best carriers who have, they get rated. So the carriers that have the highest rate of approving what the procedure your doctor wants to do is going to be UCare, Medica, Health. I don't know if Health Partners has plans in Olmsted or not, but UCare and Medica probably have the highest rate. And then it's going to be like Blue Cross, United Healthcare. They still are high, but they aren't as high as UCare and Medica.
And we've run into this a little bit. If Medicare doesn't pay something, quite often my Mayo Clinic supplement doesn't want to pay for it either, so what's up with that? You would
Well-
thought one would be to cover the deductible of the other or something.
So all the plans, Medigap and Medicare Advantage, have to follow Medicare rules. If Medicare doesn't cover it, a Medigap plan won't. Medicare Advantage, they may, like if it's acupuncture or chiropractic, Medicare Advantage plans cover that.
I guess I'm thinking if Medicare doesn't pay it all, would your supplement normally pick up the difference?
Oh, it depends on the supplement plan that you have. So, yeah, if you'd have a deductible possibly on that, and then some supplements have co-pays, some don't.
I'm having a problem because my supplement is administered through Medica,
Okay,
and I attended a meeting where a gentleman from Red Wing presented here in Olmsted County, and he said he couldn't even help me because he can't sell the same thing here that he could in Red Wing. That's a different county.
I'm not sure what he meant by that.
I think either my coverage or my premium wouldn't be the same through Medica, through him. He couldn't, I happen to live in Dodge County, which
Okay.
is just west of him.
Yeah.
And he said Dodge and Olmsted County, we can't get the same as he can do in Red Wing.
But is the product you have, 'cause I believe you mentioned earlier that you have a benefit, an actual health insurance benefit from Mayo that's no longer offered to anyone?
If you retired, I retired in the fall of 2014, and I believe in the same, after that in 2015,
Oh,
they started offering subsidies instead,
Yeah.
and then you had to buy from a pool that Mayo approved,
Yeah.
I think.
So the gentleman might have been correct, because you might have this health insurance product that was specifically designed, so when Mayo was like, how are we gonna get the best and the best of class
Yeah.
employees? We're gonna create this health insurance product that only Mayo employees have access to.
yes.
And that's probably why that
Yes.
gentleman was like, I couldn't do anything different, because this is so unique to your
Yeah.
ecosystem.
If that's what
So
you
in my
have.
case, who do I talk to as a Medica agent?
Well, we represent Medica, but if you have the one that was specifically for Mayo retirees, that's more like a group plan, and so the benefits are constructed specifically for Medica or Mayo retirees group, and the price that you're paying for it. So that's probably what he's saying is he can't offer you that plan that you first signed up for. He can offer you a Medica supplement plan, or we can too, but the rate's going to be different because it's not a group retiree plan.
So that leaves us torn, like, should we start comparing Advantage plans and see if they're even better than what we have?
Yeah, well, we'd be happy to meet with you one-on-one come October to do that. I mean, it's worth comparing. It is. And if you decide you don't want to switch, you don't pay us anything, but at least you're armed with some knowledge.
There is a caution in there, it says if I drop that plan, I can't ever get it back.
That's right. If you have a plan like that, if you leave it, you cannot get it back later. That's correct.
Kind of looks pretty serious.
Well, if you compare, you may end up asking yourself, why would I want that plan back? But especially when the rates for next year come out. So, yes.
you.
Yeah. Any other questions? Any more questions online? Okay. Well, thank you. Oh, yes.
Can you give an example of what a health question would be that would not, the insurance company would not take you?
Have you had a hospital stay in the last year?
Really?
Or even things like cataract surgery, very
Are you being treated for heart issues? Yeah.
One question would knock you out. Okay.
But that's changing next fall. With the legislature created that annual enrollment period for Medigap plans. So during that time frame, you will not be asked health questions for a Medigap plan.
That's in Minnesota.
That's in Minnesota. It is in some other states, but keep in mind that's the legislature, and they can change that back to the old way anytime they want to, too. So, any other questions? Yes.
Is that why people go down, like Florida and Texas to get the Medigap? And then can they bring that back to Minnesota with them?
If you're a resident of Texas or Florida, you could get a Medigap plan there. If you didn't carry one from Minnesota with you down there,
Or if
you,
you're just a snowbird and you just go down there?
no, it's going to be based on where your legal residence is.
So,
If you're a Minnesota resident, you cannot get a Medigap plan in Texas or Florida.
so is it kind of like the reverse of Canada? You'd have to be in Texas over so many months?
You would have to be a legal resident of that state, and Social Security is going to know where your legal residency is, so, yeah. Once you move there, then you can, yes. Okay. Well, we'll be around if you have other questions. I don't want to keep everybody